Hi, this is Laurah Lee Waldorf, Master Myotherapist here at ProactiveHealth101.com, and this is section 4 or piece 4 or part 4 of myotherapy. And just to show you, introduce you for what it is. So I introduced you, tell you what the history is, and then the experience of the first session and the second session. The third session even gets ramped up a little bit more. It's usually a couple-hour session only because we encourage you to bring a loved one in so they can learn how to do this on you, or at least observe what you're going through and have some empathy for you. And I always teach people how to work on themselves so they don't have to depend on anybody. They can just go ahead and work on themselves when they feel a spasm or a headache coming on, or they know they did a lot of work in the yard or something, so they know they need to put back into their body. Because remember, your muscles are very forgiving, but you want to put some time into them. So here's just an example of a quick fix book. And this book has different charts in it, and what we do is I will lay the book on the floor while the person is in the table and having the faceplate, and they're watching the watch as we go along. So they have a chart on the floor, and then their loved one has a chart also, and then I work on half the body, and then the loved one works on the other half the body. And then we end up coming together and figuring out, or I figure out a plan on what to do next, and then I go ahead and work on that piece. But in the meantime, the loved one and the person has an idea that they can work on themselves. So I recommend highly that before I see them the next session, and that they go ahead and at least work on themselves, or work together, or the person just work on themselves at least once. Twice would be really good. But remember, you're doing the passive stretches 4 times a day, which is like breakfast, lunch, dinner, when you go to bed. Something to remember them by that you can attach to, because the hardest thing about the exercises is to remember to do them. The whole day will go by and you go, I forgot to do my exercises. But when you feel your pain or your glitch, go ahead and do your exercises. So that pain's always a good reminder. So here's an example of one tool for myotherapy. And then this is a tool, it's a stick. It's a sanded stick. But there's other tools that you can use, many of them that I've shown you seen around. But between these two tools, you can, where you can't reach with this tool here, you can go ahead and reach with this tool, is the idea, which is wonderful. So then you don't have to depend on anybody else. You can lean this up against a wall and then lean into it if you need more pressure. You can lay it on the floor, this tool or this tool. You can just lay it on the floor and you can work on yourself that way. So as far as the charts and stuff go, I'm going to be having them as a PDF. If you're interested at all, leave your name and number under there, and you'll get some charts that you can maybe help yourself with your muscles. So if you have any questions or anything, go to proactivehealth101@gmail.com, or just go ahead and check out the other facilitators of health that you might be interested in besides muscles. This is a starter, doing the muscles first, and then we're going to go from there, and we're going to really show you some wonderful therapists out there, or people just doing all sorts of things so you can help yourself with proactive health. Anyway, love life, and life will love you back. We'll see you in the next video. Bye-bye for now.